Yes, for this week's office hour session. Excited to be here with you today and provide this space. Before we get started on the office hours conversation, we do want to flag that the JI screening portal training is also happening at this time. We do apologize for not catching the conflict, but some of you may want to switch over to that, or maybe within your county or dividing and conquering, but just wanted to make sure that you were tracking that today at the same time was one of the multiple opportunities for counties to participate in the JI screening portal training. That's the live training. Both this session and that session will be recorded and posted to the DHCS website. So you don't necessarily have to choose, but we do want to make sure that you're tracking that other training is also happening right now, and apologize for not catching the conflict sooner. We will make sure to do a better job of resolving important conflicts like this for future office hour sessions. We knew that many of you were still going to be here today, so we wanted to go ahead and proceed, but in the chat, you do have the link to the JI screening portal training if you would like to prioritize that. Like I said, we will be or we're dropping it in the link. Or there you go. Thank you. If you'd like to prioritize that, no hard feelings. We understand, and this session will be recorded and posted. So I think with that, we also just want to remind folks that your microphones are muted, but you can raise your hand during the Q&A portion to be able to ask your questions. You can also use the Q&A feature on the webinar to submit questions virtually to us. We will post the recording and transcript of this session as soon as possible. It takes a bit of time, or a little over a week, to get everything ready for posting, including going through the ADA compliance process, but just want to make sure that folks are tracking. Okay, next slide, please. We just have a few slides to go through for today's office hour session, and then we'll want to open it up to all of you to be able to ask your questions so we can make sure that we're as productive as possible with these office hour sessions. As we reported out last week, the intention of this particular office hour session is to give our county correctional facility partners, which could be sheriffs or probation departments. It could also be county health services or public health, but whoever's responsible for correctional healthcare services, we wanted to give you a space that we're able to answer any specific questions that you might have related to implementation. And then next week, we'll hold a more general office hours session with all of the participants of the Learning Collaborative series, so that others who may have similar types of questions, or community providers who want to know how this program is going to work, are able to ask their questions as well. But we wanted to afford a particular space for you all to be able to share best practices, ask questions without that larger audience. So glad you could be here today. And if you are not representing a county entity, then we'd ask you to refrain from raising your hand and asking questions today. Next, just as a reminder of the sessions that we have coming up, we have another session on September 26th focused on behavioral health services. And then in October, we'll talk about non-behavioral health services and some of the care pathways and patient journeys that you might be more familiar with in that environment and space. And then in November, we'll get into discussions about enhanced care management, the warm handoff, and all of those pieces, and then wrap up the fall Learning Collaborative series with a discussion about pharmacy policy. We do plan to continue these into the spring, winter and spring, but just letting you know what's planned and on the docket for now. We'll make adjustments and plan for the spring based on kind of where the needs lie with our county partners, based on all of
It's probably in
these
your headset.
sessions. Just a reminder, if you're not speaking, please do keep your microphone muted, and that way we can let our presenters talk. And then again, at the bottom, you see the JI screening portal session. There was one 2 days ago. Hopefully the folks that are here today participated in that prior session. There's also the session happening today at the same time. The link is in the chat. And then we have the billing and claiming training coming up next week, and we'll make sure to resolve any conflicts with office hours for that time. So we may have to move the time of office hours, but we'll make sure that it doesn't conflict with the billing and claiming training. Next slide. So we're going to go through some of the most frequent questions that we received during the prior session, so we can just kind of give you some responses to some of the questions that were posed during the session in our Q&A and walk through that. And then we'll open it up for additional questions from all of you. So we are going to kind of share the the speaking responsibilities here. So I'll ask any of my colleagues who are going to jump in to please introduce yourselves and remind folks who you are. I think I forgot to do that. My name is Autumn Boylan. I'm the Deputy Director for the Office of Strategic Partnerships and the lead for the CalAIM Justice Involved Initiative for our department. And we'll just make sure our other folks introduce themselves as we're going through. The first question that we got was about what training and resources are available for staff who are delivering pre-release services. We do have these specific training and the series that we've set up. We also have the screening portal training and the billing and claiming training. Hopefully your teams have signed up for those. All of the trainings that are being delivered live are also being recorded and posted to the DHCS website. And then, as I said, we'll be thinking about how we advance the series into the winter and spring and continue office hours to support counties with implementation. I do want to also say we do offer one-on-one sessions. We have our PATH, our PATH partner Pacific Consulting Group, PCG, that also conducts some trainings in office hours. So lots of support available to you, but this learning series is meant to kind of create a library of resources that will help counties with implementation. And then, of course, we're also going to be republishing an updated version of our policy and operations guide in the coming weeks. Next. I'm going to pass it over to my colleague, Sarah, who will introduce herself and then talk about the aid codes.
Good morning, everyone. My name is Sarah Linder. I am a section chief within our Medi-Cal eligibility division here at DHCS. So we had a couple questions about the aid codes that we wanted to highlight. What are the JI aid codes? So we're going to start with that. The aid codes are used by DHCS to track coverage and payment for Medi-Cal covered services for specific Medi-Cal populations. Effective October 1, 2024, DHCS will establish 5 new JI aid codes. The purpose of those is to identify the populations eligible to receive pre-release services, to provide access to the limited set of services available to the eligible JI population, to assist with correctly processing claims and payments, and to accurately draw down federal matching funds based on the funding for the primary Medi-Cal aid code under which the incarcerated individual is eligible. Okay, next slide, please. When and how should the JI aid code be used by implementing partners? DHCS will activate an individual's JI aid code once the correctional facility or their designated entity submits the screening information to activate the pre-release services 90 days prior to the individual's expected release, or as soon as possible for individuals with unclear lengths of stay. So this would be, the screening information would be submitted through the JI screening portal, and then pre-release services will only be available for eligible for Medicaid reimbursement if the JI aid code is active. Next slide, please. When an individual's JI aid code is removed upon release, will their primary Medi-Cal aid code be active immediately, or would it be active on the first day of the following month? An individual retains their primary Medi-Cal aid code during incarceration, although it may be suspended if necessary. Upon receiving notification of the individual's release, the Social Services Department will lift the suspension to reactivate Medi-Cal, ensuring immediate access to services. As a reminder, correctional facilities must notify Social Services Departments as soon as they are aware of an individual's expected release date, and to make every effort to provide confirmation of release within 1 week of the expected release, but no later than 1 business day, except in cases of unplanned release. And then the Medicaid managed care plan enrollment may be effective either within the month the individual was released or on the first day of the following month, depending on the day the individual's JI aid code was deactivated. Next slide. All right, Autumn, I'm going to pass it back to you for our clinic provider enrollment questions.
Just a reminder, and we'll send out all of these slides. I believe we actually did send them out prior to the session. We'll send them out again after the session. But just a reminder that our correctional facility partners, so whichever county entity is responsible for correctional healthcare services, must be enrolled with DHCS through our PAVE system as an exempt from licensure clinic. All ordering, referring, and prescribing practitioners that have an existing enrollment pathway as an ordering, referring, and prescribing practitioner must also be enrolled through our PAVE system. We talked about this at length in our session last week, but there is detailed information provided here on the links and also on the DHCS webpage. But you would need to initiate the enrollment as an exempt from licensure clinic at the same time that you submit your readiness application so that it can be reviewed and activated before your requested go live date. So we just wanted to reiterate that here today. Next. And then there's a step-by-step guide that we shared with you last week about how to enroll through our PAVE system. This is for our exempt from licensure clinics, and also all of the participating pharmacies also need to be separately enrolled through DHCS's PAVE system. And so just making sure that folks are tracking, and there's an easy step-by-step guide that shows you exactly what you need to do page by page as you navigate the PAVE system. We're also here to provide support if folks need help navigating the system, and you can request that support with our provider enrollment team, or we can help connect you if you email us directly at calaimjusticeadvisory@dhcs.ca.gov. But there's all of this information, again, is linked in the PowerPoint and was shared in our session last week. Next. Before you can enroll, the county entity that will be enrolled as the exempt from licensure clinic must obtain an NPI number or National Provider Identifier number from the National Plan and Provider Enumeration System. This is a federal requirement. It's a national website. It is not a part of the enrollment process, but it is a prerequisite to enrolling as a Medi-Cal provider through our PAVE system. It's a pretty easy process. It takes about 20 minutes. And again, last week we provided some detailed guidance about how you can navigate the NPES or National Plan and Provider Enumeration System to obtain an NPI number, including some suggestions about taxonomy codes that might be most appropriate. And we created a handy kind of document that you can use to help guide your NPI application process. So those are other resources that are also available to you, and we can make sure are shared following this session as well. Next. So there's been a lot of questions about when the billing codes will be available and billing and claiming guidance. We do have some billing and claiming guidance already available on our medical.ca.gov website and on the provider publications that are linked on this page. Last time we showed you how to navigate the fee schedule and the provider manuals. You can also sign up for our Medi-Cal subscription service to get more information that is provided to Medi-Cal providers on a regular basis. We have our Medi-Cal fee-for-service provider field representatives and telephone services center. And then there's, of course, the training that is happening next week on the 17th and 19th. That we suggest everybody sign up for the training on billing and claiming, because that's really a critical step forward to successfully implementing this initiative. Those trainings will remain available. So if you miss the ones next week or you're not going live yet and you'll need a refresher, those training materials will still be available to you. But we do suggest that you sign up for the trainings that are happening next week so that you can have the earliest possible information about the billing and claiming process. Next. Is also information on the DHCS website page under our Justice Involved webpage on the resources tab and advisory group meetings where the care management bundle code information is posted, including the webinar that we conducted in June about the care management bundle specifically. And then we published the rates at the end of August on the DHCS website, and you can see all of the billing codes for each of the 5 bundles, as well as the rates are also shown on the slide. The deck links to where you can find that information on the DHCS website. Next. So Sarah, I'm going to tap you back in for this one.
Yes, thank you. All right, so we're going to get into some questions about pre-release Medi-Cal applications. So this first question is asking if correctional facilities can submit a Medi-Cal application on behalf of an individual without their written consent. No, the answer to that is no. Federal regulations requires an application for Medi-Cal to be signed by the applicant, the parent for individuals under 18, or a designated authorized representative. When incarcerated individuals are not allowed to have access to the web or pens and paper, county social services departments have processes to accept the signatures through any available means, including telephonic or electronic signatures. The second part of this question is, can correctional facilities provide pre-release services to individuals who have not given written consent to the Medi-Cal application? And to answer that piece, if the individual is not enrolled in Medi-Cal, they are not eligible to receive pre-release services. Next slide, please. How will DHCS verify that incarcerated individuals meet the CalAIM JI Reentry Initiative eligibility criteria? In order to be eligible for pre-release services, adults must meet a qualifying healthcare need criteria. This includes mental illness, substance use disorder, chronic condition, pregnancy or postpartum, TBI, HIV and AIDS, or other intellectual or developmental disabilities. All of this criteria is outlined in our policy and operations guide. For youth, that's defined as someone under 21 or former foster youth between the ages of 18 to 26. Those individuals do not need to meet a qualifying criteria. Correctional facilities will be expected to screen all Medi-Cal eligible individuals for JI eligibility. For county facilities, we expect this screening process to occur at or close to intake. And for CDCR, we expect the screening to occur prior to the 90-day pre-release period. Correctional facilities will confirm the qualifying criteria via the JI screening portal. Next slide, please. All right, Autumn, I'm going to pass it back to you for behavioral health links.
Great. But we are answering just a couple of questions here about behavioral health links, care management, and the pharmacy meds in hand, because we know that these are top of mind. They've come up in the Q&A sessions from our prior webinars. But did want to note that the next learning series session is going to be focused specifically on the provision of behavioral health services, including the behavioral health links. So lots of information will be provided there. There will also be a full session on care management and the pharmacy policy as well. Just kind of digging into the questions that we've received so far during these learning series around data sharing for behavioral health needs and treatment preferences with post-release providers. We just want to emphasize here that data sharing is a critical part of the initiative. We do have information in the published policy and operations guide, and we're updating that information to explicitly call out when data sharing is required. And our data sharing authorization work group is putting together a specific reentry toolkit that will be out for public comment this month for folks that will provide some guidance around questions that you should ask related to data sharing for the purposes of reentry. So lots more information coming soon, and we'll also put in the chat our CalAIM data sharing authorization guidance, which is at large direction around the data sharing requirements under the CalAIM program, not just for justice involved, but for all of our CalAIM initiatives. And then that reentry toolkit will really dig into specific scenarios that county partners might face or our state correctional facilities might face in terms of data sharing with your other county partners, managed care plans, ECM providers to facilitate that warm handoff and post-release services. So more information to come, and we'll go into a bit more detail in our next learning session as well. Next. So again, this is another question about behavioral health staff sharing paperwork with incarcerated individuals. That reentry toolkit will get into that information, and also that will include specific guidance around questions that correctional facility and behavioral health partners should ask themselves related to 42 CFR Part 2, which applies to the disclosure of SUD information for individuals. And so there are specific data sharing requirements, as I just said, and the reentry toolkit will give a bit more direction and guidance, and that should be coming out shortly. Next. So a question about the intended role of ECM providers in pre-release services. So I think that there's a couple of ways to think about the role of ECM providers. One is that our ECM providers could be in-reach care managers that come into the facility or provide services via telehealth, that they are the assigned care manager responsible for all of those care management responsibilities while the individual is still in custody, and that same care management organization and care team is responsible for providing the post-release care so that there's that continuity of care happening with the care manager that is both pre-release and post-release assigned care manager. In the case where a correctional facility is using an embedded or mixed model, then the ECM provider is really kind of the recipient of that warm handoff and a partner to the embedded care manager in developing the reentry treatment plan. They should be working with the embedded care managers, providing pre-release care management to develop a relationship with the individual, to contribute to the care plan, to making sure that all of the post-release services are being coordinated for the member so that when they get out of the correctional facility setting, the ECM provider will be able to continue managing care for that individual and making sure that they're health, mental health, and substance use disorder needs are met, as well as getting our members connected to health-related social needs and services and or social supports like food banks and housing and other things like that. So the ECM provider plays a critical role in the success of the Justice Involved Initiative, and is really kind of the backbone of the initiative, is this whole idea of the warm handoff and that care management connection from the carceral setting to the community. That's really why the federal government allowed for those waivers to be implemented across multiple states, and it's really the crux of the service design for pre-release services under the waiver program. Next. And then there's been a lot of questions, I think, about best practices related to providing medications in hand upon release. We know that many counties, including Yuba and Santa Clara, who are generous enough to share with us last time, are testing different strategies for how you're going to accomplish the meds in hand. But some of those best practices that we've heard would be, partnering with a community-based pharmacy or mail order pharmacy, having a courier service, which could actually even be correctional facility staff who can go run to the community pharmacy, pick up the medications, and deliver them back to the member at the time of release. And there's other best practices and strategies that are being tested across counties. So I think here we would just open it up and see if there are folks who are part of this office hour session who'd like to share best practices. We'll also make sure that we're bringing that into one of the learning collaborative series so that we have breakout discussions and more robust conversations about the minimum supply of 30 days of medications in hand upon release. So we'll just see if folks have anything you'd like to contribute on the meds in hand discussion here today. Otherwise, like I said, we'll bring that to a future learning collaborative session. Any of our county partners want to share? Not seeing any hands raised. That's okay. Like I said, there will be more opportunities for that, and something might strike you over the course of the call. But now we just kind of want to open it up to all of you. So we covered some of the frequently asked questions that we heard in the last session, things that were coming up again and again in the chat or in the breakout rooms. And hopefully that was helpful to do that overview. But we did also want to offer some time for open forum so that folks can just ask whatever questions you might have of us, and we'll do our best to answer your questions or definitely seek out answers and follow up if necessary. So we'll just open it up. Please raise your hand or submit your questions through the Q&A, and we will be happy to take your questions now. Give a pause for a moment for folks to ask your questions. Hey, Eileen Egbo.
Thanks. I have a quick question. I don't know if it's going to be a quick answer, but if we're able to do the 90 days pre-release and the members do not have, say, they won't have managed Medi-Cal until they're released, that 30 days medication, I'm concerned about people not being able to establish care with a community provider within 30 days of release. And I don't know if that's just a local access issue or other people have the same concern, but I'm wondering how we address that.
Actually, we are concerned about that too. So great question. Our plan is when the correctional facility activates the aid code in our JI screening portal, we are also going to activate an auto assignment to a Medi-Cal managed care plan if the member hadn't been previously enrolled in a plan. So if they were previously enrolled in a particular Medi-Cal plan, then they would stay with that Medi-Cal plan. If they had not been previously enrolled with a Medi-Cal plan, then we would assign them to a plan at the time that that aid code is activated, so that the Medi-Cal plan is known to both the correctional facility and the member, as well as the plan, and can be, a part of kind of that reentry planning. So you would, once that happens, then you would contact the plan's JI liaison. They would assign an ECM provider that's enrolled with that plan, and then that member would continue to receive services in the community from that plan. Of course, our Medi-Cal members have the option to change their health plan coverage, and they have choice in which health plan will be providing them the coverage services. And so once the individual is released, they will be offered a choice packet and can choose to change their plan assignment. But we will be auto assigning while the individual is in custody in order to facilitate that enrollment and not have that gap in coverage like you're describing. Any of my colleagues, did I get it right? Do you want to add anything or clarify anything?
Autumn, I think you did a great job of describing the Medi-Cal managed care continuity structure. If somebody needs specialty mental health or substance use services through the county behavioral health agency, they will have access to those services immediately upon release. There isn't any enrollment process or anything like that. And then another part of this is through the care management and the warm handoffs. The idea is that if there is enough time prior to release, that for any critical appointments for continuity of services that a member might have, that those initial appointments can be set up and there can be some warm handoff contact made prior to release to help with that continuity.
Okay, let's see. Thanks, Brian. Next question. Thought I saw some hands raised, but now I'm not seeing them. Oh, here we go. Oh no, that's Eileen. Your hand is raised again. Anybody else want to ask a question while you've got us on the line? We know that there's a couple of questions in the Q&A, so I could go through some of those. Let's see. So a question was about whether we could please share the list of JI aid codes with us. If the list is not yet available, could you let us know when it will be distributed? Sarah provided the response that DHCS will publish the new aid codes in the Medi-Cal Provider Manual Master Aid Code Chart by October 1st. And until then, you can refer to the Managed Care Plan Aid Code Chart and linked that in the Q&A. And gave page number. So very thorough response. Thanks, Sarah. And then there's another question about whether specific tests ordered during the pre-release period will be reimbursed on a fee-for-service. Examples given are for like HIV or hepatitis C or syphilis testing for eligible individuals, or is that part of the bundled rate? That is not part of the bundled rate. It is reimbursed on a fee-for-service basis, and all of those codes are in the Medi-Cal fee schedule. And again, that billing and claiming training will be super helpful for folks to understand how to navigate all of the different billing codes. There was a question about whether the aid codes will be available in the 271 eligibility message from Medi-Cal, or is it only in the JI portal? And Sarah provided a response. Once activated, the JI aid codes will be reflected during that eligibility verification process via the 271 transactions for deeds of services being verified. lots of questions about the aid codes. And also lots of questions about the links to the trainings that are coming up on the billing and training, billing and claiming, excuse me. So we'll make sure that those are in the chat as well so that everybody has those. And we previously put in the link to the portal training, which you can also go to for the billing training. So we'll drop it in again for folks who might have missed it or joined late, but those are in the chat as well. Do we have any other questions? If not, then we'll let folks go early for today. We don't want to hold you longer than necessary, but wanted to offer space for folks to be able to answer questions or ask your questions if you have any.
Eileen, I noticed you're off mute. Did you have a follow-up question?
Oh, thanks. I did. Will the Medi-Cal website for eligibility indicate that the member is eligible? Because I'm anticipating if we reach out to PCPs to set up appointments so they're available within 30 days of release, we'll get pushback saying that they're not Medi-Cal, they're not assigned to them, whatever. And I was wondering, how can we probably need to get our provider relations involved in explaining to our contracted providers that they not only should, but we expect them to see our members.
Eileen, are you referring from a managed care perspective, managed care plan perspective?
Well, from a managed care plan perspective, as well as from ECM, because if ECM tries to set up an appointment, a lot of times they get pushback. And
Okay.
you know, we want to make sure that all invested parties are aware of the expectations.
Yeah, so I think this one goes back to what Autumn was reading around the 271. So the JI aid code, once active, will be reflected in that eligibility verification response. But because if the individual has suspended Medi-Cal due to incarceration, the managed care plan will be put on hold. So that enrollment will not be reflected through the eligibility verification responses. But if you notice in the P&O guide, there is some conversation around the managed care enrollment process, and we are adding on a JI indicator to the 834 file that goes to the managed care plans that will indicate that the individual is on our 90-day program and is expected to be released or anticipated to be released within that 90 days to allow the plans to have like a heads up or an early notification so that they can coordinate those services. Does that answer your question?
Yes, thank you. That's perfect.
No problem.
Okay, we do have, let's see, a couple of other open questions in the Q&A. So there's a question about whether the reentry toolkit that's being released is different from the data sharing toolkit and also different from the correctional facility readiness toolkit. Yes. So there, I know we're naming everything a toolkit. We have a data sharing toolkit through that we published in October of 2023 that provides guidance and direction around data sharing requirements under the CalAIM initiative at large. The reentry toolkit is kind of a sub of that larger data sharing toolkit. The data sharing toolkit is really about kind of all of the privacy rules and consent requirements and other pieces. The reentry toolkit that I referenced that will be coming out for stakeholder comment this month is really more about like, here's a specific scenario and the points at which you would need to obtain consent from the member for sharing data, what questions correctional facilities might need to ask themselves during that process to determine if they're subject to requirements of the 42 CFR Part 2, for example. And so it's much more like practical, hands-on for correctional facilities and reentry providers, specifically around this reentry initiative, whereas the data sharing authorization guidance at large is kind of more the rules of the road that apply to everybody. This is meant to provide a more practical example of how you might apply those rules to the reentry process. So that'll be coming out shortly. And then the correctional facility readiness toolkit is I think what you're referring to there is kind of the readiness review application for operational readiness and all of those pieces, and that is distinct from the data sharing guidance that we were discussing. I do see a hand from Michelle F.
Hello. Morning, thank you. My question is about behavioral health links evaluations, documentation and billing in terms of using specialty mental health versus DMC. What programs are other counties billing through, or is there any guidance around what we might bill through if the same clinician is doing both evaluations, or possibly counties are having two different people come in to do the specialty mental health versus the SUD evaluation? So I'm just curious how that's going, or if there's any guidance around that.
Yeah, thanks. I think that's a good question. I will say that it's even further complicated by the fact that all of these services are billed through our fee-for-service delivery system and not as specialty mental health services through our county behavioral health agencies. So I believe that we will be providing some guidance around that, but I actually don't know the answer to your question off the top of
I
my
thought that the behavioral health links evaluations conducted by the county behavioral health department were Bill, that maybe I'm misunderstanding what you said,
by the
but
county behavioral health agency. Megan or somebody, do you want to clarify here for me?
Yeah, sure. My name is Megan Chandel. I'm on the reentry team in the Justice Involved branch underneath Autumn. I'm not the behavioral health billing expert, so I'll preface what I'm going to say with that. However, all pre-release services will be billed and claimed via fee for service.
yeah, this isn't, well, and maybe I'm misunderstanding how you're defining a pre-release service. This is county behavioral health coming in to do a links evaluation that was requested. And I thought that those were
That
not
can be
going
billed
to
through
be
short
billed
oil.
through, right, that's what I thought.
If it's the
Even
county
if they,
behavioral health agency receiving the link.
But
that's
is
right.
that the health risk assessments or the
No.
reentry care plan development?
No,
I think
it's
just receiving the link can go
that's
through
right.
the
Yeah.
county short oil.
Yeah, we'll have to take it back to see if like what constitutes the receiving of the behavioral health thing, just to make sure we're in alignment with how you're asking the question. But yeah, I believe that's correct.
This essentially comes out of the reentry plan stemming from the health risk assessment. The reentry plan says, oh, they need to be linked to specialty mental health. And let's say they need to be linked to specialty mental health and to SUD services through DMC. So county behavioral health comes in to do those evaluations to see what services they're eligible for, what level of care, et cetera, et cetera. That specific evaluation, we're planning to have one clinician do both. We're curious about billing and documentation, which system to use, basically.
Yeah,
We will, oh, go ahead, Megan.
go ahead, Autumn.
I was just gonna say, we'll make sure that we clarify this in the next learning series session, which is focused on behavioral health links.
Perfect. Okay. Thanks.
And behavioral health services specifically. So I think Megan has the right idea. We'll take it back and clarify, just because I think I'm getting a little confused too. So just want to make sure that we give you the right information. And then there's also some questions from Marin County in the Q&A around the behavioral health links, and we'll address all of those in the next learning session as well.
That was our question. I just unmuted to ask it. So it's the same question.
Okay, great. Thanks. Okay, any other final questions? I know that we still have a few in the Q&A. We just talked about the question from Nicole about county behavioral health agencies and contracted providers needing to enroll as fee-for-service providers. Yes, you will need to enroll as fee-for-service providers for county-run clinics and contracted providers. We are working on the enrollment pathway for that, and we'll give guidance and direction about how to implement that enrollment through the PAVE system. But yes, you will need to enroll as a fee-for-service provider in order to get reimbursed for pre-release services, with the exception of what we were just discussing, and we'll clarify that and discuss that during the next session.
Autumn, just also acknowledging the question around the JI screening portal. I know this is covered in the technical training that they're doing, that our CAMUS partners are performing, but we can, oh, it looks like it might have been answered as I said that. I was gonna say we could always take it back and make sure that we have a response for that for questions that we received.
Great, thanks, Sarah. All right, I think that's just about everything that we have in the Q&A. There's a question about how we can find out about our admin for the DHCS provider portal and JI portal.
That's the one I was just referencing.
Oh, sorry.
No worries. It disappeared off of there and then it's back. So yeah, that's the one. The CAMUS technical training on the JI screening portal would cover this, but what we could do is take the question back so that we have some guidance on that.
Great, thanks. Sorry, I misunderstood, but you were answering there. Great. So thanks, everybody. I don't see any other hands raised. We don't have any other active questions. Hopefully the office hours session was useful and helpful for you. We'll continue to do these following the learning collaborative sessions, where we'll kind of bring back some FAQs, make sure we're clarifying, and then open it up. So please feel free to bring your questions. That's why we're here. And look forward to seeing you next time. Thanks, everybody.